Welcome to Soul Wellness with Kristen, where we get into the nitty-gritty of various holistic modalities and explore exactly how they help you heal. I'm your host, Kristen, and I invite you to join me on this enlightening expedition where we explore the connection between mind, body, and spirit. In each episode, we'll talk in depth with holistic providers, medical professionals, therapists, and healers. Our goal is to empower you with knowledge, inspire you with stories of resilience, and provide practical tools that you can integrate into your daily life. So, find a comfortable space and join us as we explore the multifaceted world of holistic wellness. Get ready to learn how to improve every aspect of your life and simply feel good. The adventure begins now. Thank you for joining us today. I have Ashley Dorado with me. She is with Myo Movement, and she is a myofunctional therapist, and she's here to tell us all about this really unique modality. So welcome, Ashley.
Thanks for having me, Kristen. I'm so excited. As you know, I love to get the word out and really just educate and empower everybody and really talk. Today, I know we'll get into what is myofunctional therapy and then how it can benefit and who it can benefit.
I had never heard of it before until I opened up the can of worms with holistic dentistry and realized all of the issues I had going on with my teeth and my nose and breathing and all of these things that I had no idea. And you were the first person I was referred to. So I am actually a client of yours, so I can talk a little bit about the experience, which has been really unique. So first and foremost, what exactly is myofunctional therapy?
Sure. Yeah. You're not alone. Most people are like, I've been referred here. I don't know what you do. I don't know why, but let's see what we do. So really, myofunctional therapy is pretty simply physical therapy for the head, neck, and jaws. We want to get your muscles functioning for you and not against you. Mm-hmm. We want to make sure that we're able to get a proper, we call it oral resting posture, but basically where you are in a state of relaxation with your tongue actually suctioned to the roof of your mouth gently when we're at rest, which will help open the airway, help promote nasal breathing, and just really create balance even with your overall posture as well.
So who sees you? People with obviously restricted airways, maybe people that clench their teeth, TMJ. Tell us about who sees you.
Yeah, you hit all of those. So clenchers, grinders, TMJ issues are really prevalent, and myself, I struggle with those as well. So definitely those clients come find me. Snoring, sleep apnea, sleep disordered breathing. Those clients reach out because it all, it's multifaceted. So I'm able to work with the function instead of just saying like, okay, well, you're prescribed a CPAP, that's good enough. We're able to really actually open up the airway by retraining the muscles. Even clients that your teeth have shifted after ortho, which so many of us now, we're adults. I have clients that come in that have been recommended their fourth treatment of orthodontics. And instead of looking to the root cause, the ortho's just like, here you go, here's your $6,000 plan. Let's just tweak a couple things again instead of saying like, well, why are they shifting? So myofunctional therapy really looks to the root cause and is really a collaborative approach, as you know, working with a variety of providers to, the myo does the function, but we do need to take a look at the structure and make sure that everything is balanced there. I will also say like behavior issues. So adults and kids with, ADHD diagnosis or potential diagnosis, irritability, even waking to use the restroom at night as an adult is common but not normal. That actually shouldn't be happening. And then on the flip side, for kids, that usually presents more like bedwetting. Even we call it like digit or thumb sucking habits, even like lip licking, cheek. That's a tongue twister for the morning. Yes. Cheek biting. All of those things are actually dysfunctional for your body, and your body is asking for help.
So even when you're eating and you bite your cheek, bite your lip?
Yes, that is not how our body is meant or intended to. So once again, we look to the why. So sometimes our jaw will have like we call it a lateralization. So the jaw will move side to side with the tongue, where ideally it should move pretty independently. So we should be able to have control and coordination with our tongue to push the food to actually form a bolus, we call it, and then make sure we're chewing bilaterally, so on each side. And the tongue plays a huge role with that. So a lot of times when we're biting our cheek while we're eating, things are off. Our jaw will kind of shift and we'll kind of catch something.
Oh my goodness.
Yeah.
So interesting. I'm always biting the inside of my mouth.
Yes.
It's so interesting. I have to say my own personal experience, what ultimately led me to you was the fact that my gums are receding. And I have had a tissue graft on both sides, 10, 12 years ago, and it's gone. Like, it's gone. Gums are still receding. And it was talking to a holistic dentist who said, until you get your bite fixed, it's not going to stop.
Yeah.
You have to get to the root cause.
Exactly.
And we got to the root cause. We did the scan. Here, I was sent to Charlotte to see you.
Yes.
So it's so interesting how this has all panned out, and I've learned about you.
Exactly. And yeah, with your case, when we have the recession where the gum is basically pulling away from the tooth structure, we think about the bone holding the teeth into place, but there are ligaments, and the gum does play a crucial role in that as well. So when we see things aren't going to get better, they're unfortunately only going to get worse, and that especially that clenching and grinding effect really has a negative impact on the periodontium that we call it.
Right.
Yeah.
And you used to be a dental hygienist, correct?
Yes, so I'm actually still a dental hygienist.
Are
so
you really?
Yeah. So I'm a registered dental hygienist, and I've specialized in myofunctional therapy.
Okay.
So I'm actually also an adjunct instructor at the community college local here for hygiene. So I work a few days sometimes in the clinic, and then also teach nutrition didactically in the fall. So
how cool.
Yeah, I get to spread the kind of myo eye, as we call it, to the students, which is really incredible, because really in 2017, the ADA, the American Dental Association, put out a statement that we need, as dental professionals, we need to be screening for the airway. Well, we're a lot closer to 2027 versus 2017.
Yeah.
And unless you find an incredible holistic biological dentist, nobody's really talking about it. So we need to be, and it needs to be mainstream. So I feel very blessed to have that opportunity to really, from the ground up, have these students, they'll look at recession, and instead of just recording it, they'll start asking you questions like, gosh, are you a clencher or grinder? Or gosh, are you having trouble sleeping or breathing through your nose? Anything like that. And then it just opens that can of worms, which sometimes
does.
Yeah.
It's incredible.
Yeah,
and I learned from the holistic dentist group that clenching your teeth, usually you're not getting enough air at night. That's what's happening. That's why your body is in fight or flight, even when you're unconscious, which is not normal. You should be at rest, at ease, but your body is almost fighting because you want to breathe. And the waking up in the night to go to the restroom.
Yes.
I learned that from the holistic dentist too.
Yep.
It's so fascinating.
And with the clenching and grinding, I always try and give this visual to my clients. If you think about when we clench down, it opens up the airway just a little bit, so we start to get that relief. And then when we grind that bottom jaw forward, the airway opens even more. So yeah, we would always say like, oh, I'm stressed, it's family, it's work, it's this. Yeah, that plays a small part, but it is the airway. Our body, exactly as you said it, we're in that constant fight or flight mode, and it's caused the damage that we see. So your body will really do anything to breathe and to swallow. Right. So I see a lot of clients that their teeth, we call it occlusal or incisal wear, or attrition. There are multiple names for it, but basically where the teeth have been flattened from that. Wow. And the body ideally doesn't want to do that, but it'll do that because it has to. And that's where that recession comes in too, because it needs to breathe and it needs to swallow. So however it does that and compensates and adapts is really what we look towards the issues.
Yeah. Tell everybody, what's a normal schedule of working with you?
Yep. So typically, not everybody needs a referral to come see me. Some clients will certainly be referred from usually a holistic dentist, or sometimes an orthodontist, sometimes an ENT, but you can also find us on some of the myofunctional directories, or of course Google. You can find us there and just reach out yourself. So you don't need a referral. But when you reach out, what we do is, for some clients, we'll do a 15-minute complimentary discovery call. So just to kind of go over some symptoms and kind of see, hey, is this worth kind of looking into this? Most clients, after talking, we say, yeah, let's do an evaluation. That's going to be the next step. So the comprehensive intake evaluation really looks at the function. So we look at, how the muscles of the head, neck, and jaws are moving for you and against you. We take some measurements. We, take videos, we take pictures, and do a full occlusion exam as well. So lots of data collecting that we can clinically see. We look at your airway. We look at what we call like the Malampati and Friedman tongue position, and then Brodsky, which is tonsils. And then we get a game plan. And then we say, okay, great. Most people really can benefit from myofunctional therapy. So it's really, sometimes I feel like it almost feels like the magic wand or like the dot to the I or the icing on the cake, whatever analogy you want to use. But my part of it is that function part. So I have plenty of clients that think that they're fixing the structure by getting their tonsils or adenoids removed, or by having ortho. That may be a piece of the puzzle, but that doesn't fix the whole, round out the whole treatment system. So during that functional eval, if they haven't seen other providers, usually I'll recommend, potentially a cone beam image, so like a 3D X-ray, to really look at the airway, see where there's narrowing, usually a referral to a potential orthodontist to see, gosh, we do have these structural issues, or just to get, we're always collecting information. And then sometimes an ear, nose, and throat referral is indicated as well. So I really kind of lay out the team that we may need. It doesn't have to happen that day. Usually what I recommend is we can start myo, and then we're always going down the same path, because we're getting those muscles stronger and getting movement that we haven't had before while we're collecting information. And then typically I see clients usually about every 2 weeks as therapy continues, or if we're waiting on some kind of decision making through the informational and structural ways, sometimes it'll go about 4 to 6 weeks, as long as they're kind of doing their homework and doing the exercises. But I do like my clients to know that myofunctional therapy isn't forever. Once we're able to get things working properly for you, I don't want to see you anymore. I'll come to your kid's t-ball game, but tell your friends, but I want to get you healthy and not on a constant like, okay, well now I have to do myofunctional therapy forever. I'm doing chiropractic work forever, which body work is so important and definitely necessary. But that's the nice thing about mine. It's not a modality that you're going to have forever.
But it's something that you can still do, because you give me exercises, and whether I'm seeing you regularly or not, I'm still doing some form of exercise every day.
Exactly. Yeah. So, and what I find really cool, depending on the client's, chief complaint, we call it, whether it be relief or whether it be severe obstructive sleep apnea, clients can kind of cater that to how much exercises they do have to do after they graduate, or kind of when we're working together. So I have some clients that, they graduate and they still do, let's say, 5 to 10 minutes of active myo a day, because they are so afraid of going back to how they were before they met me. And then I have clients that we're in a great holding pattern, and your body, now that it's been retrained and that neuromuscular re-education, like when I'm driving, I'll have my tongue up, and I'll start doing some clicks and TikToks and some different things just to get some movement. So I don't, in my mind, see that as like, true myo that I'm, sitting down and working on daily, but now it's been incorporated into my life. And every time I wash my hands in the bathroom, I'll do like a suction and hold. So that it kind of becomes almost more automated.
Right.
But yes, definitely it is for life. So yes, you're right. It is for life, but seeing a therapist should not ideally be for life.
Yeah. That's so fascinating. I want to talk about TMJ for just a second. If someone is having mobility issues, opening their mouth, or if they're having pain, clicking, that kind of thing, does myofunctional therapy help with that?
Definitely.
Okay.
So I will say that the TMJ, or the temporomandibular joint, is very complex. So that really, once again, like everything else, does take a combination of specialists. And I will say, really, it depends on the symptoms, the severity, and the client goals. So I have some clients that, we could do, recommend an orthotic or some sort of apparatus to kind of help with the jaw alignment. But with, the function and getting their muscles to work better and kind of reduce that fight or flight response and that stress, we're able to get them to 80, 90%, and that's good enough for them.
Right.
So it really depends on the client goals and how far they get as well. So I had a recent graduate client, I'd say mid or late 30s, chief complaint, severe clenching and grinding. So we found out she has a deviated septum, which a lot of us do because of that growth and development pattern. And we were kind of weighing the options for her, should we go through this surgery? Should we not? And as we got closer, she's like, Ashley, my symptoms are so resolved. I feel great. And I can always later circle back if I want.
Right.
But with that was enough for her. Now, that is definitely not the case for everybody. But
that's amazing.
It's amazing, right? That's the one thing, another thing that I love about Myo is we have seen benefits with every client. Every client. So I actually can say that. Like, you will benefit in some way.
In some way.
In some way. So that's where I get really excited. So it isn't always, it's not the end all be all, but a lot of times it's just that missing piece that really pulls everything together and really just gets your body into that proper oral resting position where it's not in that constant tightness, especially when you were talking about the temporomandibular joint. We see a lot of tension then throughout the SCM and just different muscles in our, in our shoulders and our neck and our forward head posture. So a lot of times with my TMJ clients, I'll recommend definitely body work and, myofascial therapy. So to really get that full release or relief, and even sometimes a release, a tongue tie release may be indicated as well to get that full relief.
Yeah. Wow.
Yeah.
So fascinating.
Yeah, I know. I feel like I could talk about it for days because it's just, we are all, and I always say, like, our bodies are all unique, but really our body wants, it can heal itself and it wants to help us. It's not here, for these compensations and adaptations, but it's always doing the best it can with our environment, right? A lot of clients, to kind of segue, a lot of clients will say, like, well, gosh, why am I like this? Or why does everybody that I see, all of my, my daughter's friends at preschool, why do they all breathe through their mouth? Like, that must be normal. It's not. Yes. It is so common because of epigenetics. So the environment, our pollen has been off the charts, right? This year, we live in pollution. We live in cities. Even here in Mooresville, so many people are moving here. So that plays a big part on why our airways are getting smaller. Our diets are soft, right? We always talk about what smoothie we're going to have, or giving our kids pouches because it's convenient, and I would give my daughter an applesauce pouch or a yogurt pouch, but they're not using their jaws from that young age. So the highly processed food has been detrimental to our smaller airways as well. Yeah.
That's so interesting. It really is. Yeah. Wow. I love the fact that your modality just goes right into the root cause of so many different things instead of just getting surgery to try to fix something. And literally, I have a deviated septum, found out through the holistic dentist, went and saw an ENT, went and saw a plastic surgeon. They were all gung-ho to give me rhinoplasty and let's get going with this nose job, right? Get this fixed. And the holistic dentist said, oh, no, you can't. Wait. You got to get your mouth, your jaw fixed before you can have your nose fixed because your septum is deviated because there wasn't enough room.
Exactly.
As you were growing.
Exactly.
Like, oh my gosh.
Yes. The actual, like, a deviated septum is actually the cartilage in the nose deviates or kind of swerves to one side or the other. And it's becoming so common now. All of those things that I just touched on, our jaws are small and we have like a high or narrow palate.
Yes.
And the roof of the mouth is the floor of the nose. So if we don't fix the roof of the mouth and we're still going to have those airway issues.
Yes.
So yeah, exactly. And that's why having the right team is so important because it is complex and everyone is unique. But when we look to that actual root cause and not just siloing ourselves and say, okay, like, let's just do a rhinoplasty and that'll fix everything. No. We have to look at the whole picture. You may still need, rhinoplasty after the fact, right? But
maybe.
Right. But we'll see. And we'll see how things turn out.
But it's not smart to do it until there's room.
Exactly.
And that's exactly what the dentist said. The holistic dentist said, if you go get a nose job right now, it may not work. Yep. And here's why. There's no room.
There's no room.
Oh my gosh.
And then you'll be back in their office 5 years later saying, wait a second, I'm having these issues. Well, that's because, once again, the root cause was never fixed.
Exactly.
And even my adults and kiddos that have their tonsils and adenoids removed, I'm definitely an advocate of surgery when indicated, 100%. If they're, blocking. The interesting thing about myofunctional therapy is if from a young age, when we're able to kind of structurally work with expanding, we're able to reduce the size of the tonsils and the adenoids. And then from the actual function, so from that myofunctional spot, we're able to work on, well, why were they enlarged in the first place? And a lot of times it's that mouth breathing. So I'm able to work with the lip seal, and then getting that, we talk a lot about nasal hygiene and being able to facilitate that nasal breathing. So it all comes full circle. So if you have a kiddo out there that you went through the surgery and things improved, and now they're not, now things are coming back, that's probably why, because the root cause of why the inflammation was there was never addressed.
Wow.
Yeah, I feel very strongly on that, if you could tell.
Yes.
So,
I highly recommend anyone with kids to see a holistic dentist or someone like yourself.
Yeah.
Get to the root cause. Then, look at me as a 50-year-old, 50-something-year-old. Now I'm having to go back and correct things that were never even looked at. Yes. I went to an orthodontist. I had braces. I've got a nice straight smile.
Oh, yeah.
But would never know what's going on inside, that I don't have enough room.
Exactly.
It's really fascinating.
Yeah. And now, unfortunately, with what your journey that you're going through, more time, a whole lot more money, and just those years that you haven't been sleeping restoratively. And I know, headaches have been a thing for you as well. So all of those years, it's never too late for us, which is why it's incredible that you're going through this journey. But if we can, for our children, for our nieces and nephews, advocate for them from a young age. And gosh, things are so much easier. And I always joke to the parents and the kids that I work with, it's like, they feel like they're on this hamster wheel because they're going to Myo, they're going to OT, they're going to speech, they feel like they're on this constant, but I'm like, I can assure you that this will stop. All of these appointments will stop because you've gotten the structure and you've gotten the function from a young age.
Yes.
And then they're going to be eons ahead, and just, better behavior, better sleep, better life quality.
Better life quality for sure. Yeah. Oh, so interesting. And I'm so grateful to have had you come here and do this podcast. You're located in Charlotte. Tell everybody how to find you if they want to work with you.
Sure, definitely. Yeah. And thank you so much for having me.
Of course.
I've really been honored. So our practice, our main location is Charlotte. It is Wesley Heights neighborhood, just outside of Uptown. So it's actually close to the highways, which is nice as well if you are coming from afar. You can visit our website at www.myo-movement.com. You can also find us on Instagram at MYO_MOVEMENT. So Myo Movement.
Myo Movement.
Yep, on Instagram. And then you can reach us, by phone, by text, by email, by fax. All of our contact information is up there. And even for providers that may be listening who want to kind of educate their team or potentially, get a little bit more information, I always offer like my version of a lunch and learn, which I call Myo and Muffins. So I go to different offices and just help to educate the team of how they can better screen their patients and actually make a difference in their lives, because the patients always remember who identified that. And even if they weren't the one to fix it, they knew where to send you. So I get really excited about the screening aspect of it, and then having them find me. So and my practice has been growing. We're expanding. I just opened another office in the same space, so we're able to see more clients and just really help so many people. So I'm very excited about it. Yeah,
I love it. Well, thanks for being here, and I'm so happy to help you spread the word about your incredible modality.
Yes, thank you. Thank you so much, Kristen. I appreciate it.
Thank you for joining us on another enriching episode of Soul Wellness with Kristen. We hope the insights shared today have resonated with you, inspiring a deeper connection to your own journey towards holistic well-being. If you enjoyed today's episode, we invite you to subscribe, share, and reach out. Your feedback fuels our mission to bring you meaningful content that educates, empowers, and uplifts. Remember, you are a vital part of this community, and together we're creating a ripple effect of positive change.